I am going to speak today about the WELL Community Standard, the what and the why. Could I just get a raising of hands who has heard of the WELL Standard? Okay. Who has had experience working with the WELL Building Standard? Okay, a couple of people. Who has had experience working with the WELL Community Standard? Okay. All right. So this is hopefully useful then. So a well-known quote, and also very true, we shape our buildings and thereafter they shape us. And I think that speaks similarly to what you said from the Essex Design Guide. This is not a recent quote. This is something that we instinctively have known for many years, and it's not changed. However, our understanding of the intricacies of how our environment affects us has changed as we've been able to study it more, and also as we've changed our environments more. If you look at these two pictures, could I get a raising of hands? Who would like to visit or live in the picture with all the greenery? Okay. Who would like to live in the grungy area with no pavement and no human life evidence? Anyone? Okay. So that's quite a stark contrast, but it shows a lot of the characteristics that we might look for in a community. It shows people, it shows social networks, it shows places for people to interact with each other. It shows greenery and biophilia. It also in some ways shows air quality because you can see that there's going to be some particulate matter attaching to the buildings on the left. We can't know for sure, looking at those buildings, that the picture on the right, my right, possibly your left, doesn't show a sterile community where people don't interact. We don't know for fact that the picture of the dense, grungy building doesn't house an incredibly vibrant social network. We don't know that. We can only see the outside. And one of the things that we, as planners, as developers, as people who manage buildings, are trying to do more is to get into the social aspects of buildings and communities and not just providing the physical infrastructure. So one of the things that's very interesting is the increasing evidence for the impact of how we build communities and plan communities on our actual health and well-being outcomes. You may be familiar with this. I'm sure Laura from NHS is familiar. This is some work done by Public Health England. It's called Spatial Planning for Health. And what they did was a sort of umbrella review of the evidence for various planning strategies and what the impact on health and well-being outcomes in. I have taken snapshots here, and these aren't even the full diagrams, but I wanted to show you a couple of different strategies that they looked at. What you'll see is that where there's a red arrow, they're saying there's good evidence that this strategy has this impact. And then there's another bit to the chart that you don't see where they go into what the health outcomes are, whether it's cardiovascular health, whether it's improving BMI, whether it's addressing loneliness. Oops, I'm so sorry. Don't know how that happened. But what's interesting is that some of the strategies that might be looked on with a little bit more, not irony, not sarcasm, but perhaps skepticism, such as healthy food environments, actually has some pretty decent evidence, medium quality evidence, certainly something that's worth exploring more, particularly, as I'm going to show you the next slide, which looks at the health challenges we have in the UK. So this is analysis that's actually done by the International Well Building Institute, which is the organization that runs the WELL program. What they have done is put together country briefs for some of the countries that are where the WELL standard is most active, and they have looked at the Global Disease Burden Study, Global Burden of Disease Study, and they looked at disability life years and identified the factors that are modifiable for each country and ranked them. They then do a further analysis where they look at whether those factors are influenced by the features within the WELL standard. So whether by following a WELL standard credit, you would affect a factor that is a key risk in your country. So these are the top 10 based on their analysis. And the ones that they've highlighted, smoking, alcohol use, low whole grains, drug use, low fruit and ambient particulate matter, are the ones that they've highlighted as the WELL building actually, the WELL standard actually addressing. But if you look at the Public Health England research, where they're showing healthier food environments are having an impact on, so you'll see that is all substantiated by the Public Health England issue. But for example, high body mass index, where that's the third highest risk factor on this list, the physical promoting physically active transport is also a strategy within the WELL building standard, and they haven't highlighted that here, although other research would suggest that they could have. So the WELL Community Standard is a pilot. It was released in 2017. It focuses specifically on health and well-being. It's not an environmental standard. So many people in the audience will be familiar with BREEAM. It has some similarities to BREEAM, and I'll go into that at the end, but it is not the same program. It is not going to have any interest in your energy efficiency levels or your water efficiency levels. What the WELL Community Standard cares about is access to water, the quality of water that you're providing. There is some stuff on waste treatment and recycling, but they're also going to be looking at hazardous waste and how are you treating waste that might be harmful to people in the community. It's a very flexible approach. So WELL is very different from, for those of you who might have had experience with LEED. LEED is very strict. You do what we say, or you don't do it. WELL is intent focused. So if you can show that you can address the intent of a feature in a way that they haven't thought about or that is specific to the context of your community, then your WELL coach will work with you to find a way to make that work. They're very focused on wanting to achieve impact and intent, not on the everybody having to do it exactly the same way. So it's flexible, it's customized, it's outcome focused. One of the differences between WELL and many of the other green standards that you might be familiar with is that it does require recertification. Because it's outcome focused and you have performance testing associated with the standard. So for example, you'd be looking at air quality. You wouldn't just be showing them an air quality management plan. You'd be showing them testing that shows that air quality meets, for example, the ambient particulate matter standard. And then if you want to be recertified 5 years later, you need to show that the air quality still meets those standards. Air quality is an interesting point. I'm happy to talk with people who are saying, my community cannot possibly meet those air quality standards. What can I do? There is flexibility. There are other ways to obtain WELL certification, but I won't go into them now because it's a long conversation. There's currently 16 registered projects, and you can see from the map that they are all around the world. And there's a number of other projects that are considering whether or not to go for WELL communities, but haven't registered yet. So some key differentiators, I've already talked about some of these here, but I would say the big difference is the emphasis on public health. So within WELL, it's actually giving the opportunity for a developer or for an owner who might not be developing a new community but might have a large investment in existing property to say, well, what's the best practice approach to community health? And are there gaps that the government is not filling? If that's the case, how can you help to either work with partners to fill those gaps, or how can you fill those gaps yourself? There's also a real focus on quality and accessibility of public space and green space. It'll be very familiar to planners, but this is not a planning-based certification. This is a certification that an owner or a developer would choose to go for, and they would probably work with local planners, but it might not even be for a new neighborhood, in which case you might not have planning involvement at all. This might be for an existing neighborhood where you want to improve health and well-being within that neighborhood without raising it to the ground and starting over. One of the other great, I think, aspects of the WELL building standard is that they like working with other standards. They've published loads of different crosswalks to different standards, BREEAM being one of them, although not for the community program yet, because they don't do it for pilot programs. But they are very interested in working with other programs, and they do offer credits within their system for other certifications. So you can see listed on the left the ones that they would give credit for within the community program. There are also some requirements around the number of buildings within the community that have to be health and wellness certified. So for all communities, you'd have to have at least one health and wellness certified building. For new communities where you're developing new, the requirement goes up, and I'm going to say offhand it's 15% of gross floor area or total building count. But that is the building count that is owned or to the benefit of the project owner, because your community might very well, and almost certainly will, include buildings that you do not own and public realm that you do not operate. And that is another interesting difference within the WELL Communities program. So that brings me on to the community boundaries. The community boundaries are defined by the project, and they're subject to review by the International WELL Building Institute. It frequently includes buildings in public realm that are outside of the project owner's control, and that's where partnership building, getting in touch with other interested entities within the neighborhood is a really important component of this. And it can include existing neighborhoods and new developments. Obviously, it's going to be a bit easier if you've got a big piece of land in Dubai that nobody's touched before and you get to master plan that, but that's not always the case. So it's a very comprehensive approach to well-being, and as I've mentioned along the way, they take into account some aspects that are not always considered. So these are the 10 concepts: air, water, nourishment, light, movement, thermal comfort, sound, materials, mind, and community. For those who are familiar with the WELL building standard, it uses the same concepts as WELL v2 for buildings, but the features are actually very different. So if you go in and you have a look at what is the requirement for, let's see, thermal comfort, you'll see some requirements for emergency planning, for are you providing comfort cooling stations to the public during heat waves? Are you making announcements at times when there is extreme weather for how people can take care of themselves and what help is available? That's very different from within the WELL building standard, which would be just entirely focused on the occupiers within your building and a little bit of public realm external to it. So how do WELL and BREEAM communities compare? Well, I think a few things will probably have become clear as I've been speaking. There's a really different emphasis within BREEAM communities. It's more of a master plan focus. It's more frequently used for new developments. The eligibility criteria is basically a list of questions about the impact that the community development is going to have and the mix of uses, where the WELL eligibility is about the size of development, and that could be an existing neighborhood. It doesn't have to be a new development, and also the mix of uses within the community boundaries. There's also a real focus within BREEAM on impact assessments, and there's a larger focus within WELL on outcomes. So there's very big focus on performance testing and performance verification within the WELL standard, because it's not just about what you plan, it's what actually gets delivered. And there's a real focus on the lived experience of the people in the community. In terms of categories, although they look very different here, when you drill down within BREEAM, they're actually quite similar. They address similar topics, and BREEAM is definitely more health and well-being focused than, say, LEED for neighborhoods would be. But there are some key differences, and those would be around mental health, which is much more substantively addressed by WELL, and also smoking and substance use is a fairly important component of the community standard in WELL. So any questions, please let me know. Happy to talk about WELL in all its different facets, whether the building or community standard.